Hey guys, welcome back to my YouTube channel The BDS Graduate. సో ఈరోజు నేను BDS ఫైనల్ ఇయర్లో ఓరల్ సర్జరీ నుంచి క్యావర్నస్ సైనస్ థ్రాంబోసిస్ టాపిక్ గురించి డిస్కస్ చేస్తున్నాను. కమింగ్ టు దిస్, ఇట్ ఈస్ అన్ ఇన్ఫ్లమేటరీ ఇన్వాల్వ్మెంట్ ఆఫ్ ఎనీ వీన్ ఇన్ ద ఫేస్ రీజియన్ దట్ ఈస్ డేంజరస్ because there is a communication between the intracranial and as well as extracranial veins. And if the thrombosis and infection extended into veins of the dura mater, it results in the meningitis. It may be fatal for the patient. Nothing but death of the patient will occur. So the pathways by which this infection communication from extracranial veins to intracranial veins. The pathways are like emissary veins, plexus of veins surrounding the nerves leaving the cranium. The third one is communication of facial veins plus ophthalmic veins, and the fourth one is diplomic veins, and fifth one is communication through the ophthalmic vein, that is most clinical important, and the sixth one is abducens nerve, and the seventh one is oculomotor nerve, and the eighth one is trochlear nerve. And mainly the clinical features include sinusitis, headache, fever, malaise prior to ocular symptoms, prior to eye symptoms. And the next one is later complaints of orbital eye fullness and pain and visual disturbances. Mainly these are important, like signs of venous congestion. In the signs of venous congestion, first one is chemosis occur. What is chemosis? It is a swelling of the bulbar conjunctiva. And the second one is edema of eyelid also occur, and the third one is periorbital edema. These three features are comes under the signs of venous congestion. So first one is chemosis, and the second one is edema of eyelid, and third one is periorbital edema. The picture, it is clearly showing at the swelling of bulbar conjunctiva, right? It is nothing but chemosis. And the next one is the signs of increasing the retrobulbar pressure. What are those signs? One is ectophthalmos, and the second one is ophthalmoplegia, nothing but paralysis of eye muscles, and the third one is loss of corneal reflex, and the third one is meningeal signs. So the most important sign is Brudzinski sign. So it is nothing but the neck rigidity, the passive flexion of a neck. It may causes the flexion of both the legs as well as thighs. So the neck rigidity and as well as the passive flexion of a neck, it may causes the flexion of both the legs and the thighs. It is showing in that picture. And the next one is systemic signs like chills, fever, delirium and shock. And coming to its investigations, one is blood leukocytosis, and the next one is CSF examination like meningitis, and the third one is CT scan, and the fourth one is lumbar puncture. Nothing but it is mainly for optic neuritis case. And the treatment is, one is antibiotic broad spectrum, and the second one is anticoagulant like heparin, and the third one is steroids to decrease the inflammation, and the fourth one is the primary source of infection. It must be treated. Okay, thank you for watching. Please do subscribe my channel.